Hello and welcome to this webinar on the Cert 3 in non-emergency patient transport with St John Vic. My name's Andrew Mills and I'll be your host. My background was I was a paramedic with the London Ambulance Service for a couple of years. I've now been with St John Vic for a couple of years as well, working in both commercial training and the patient transport side as well. So this webinar is going to take you through a couple of points. We're going to briefly talk about the St John Ambulance Victoria, as well as why do the non-emergency patient transport course, the structure of the course, as well as contact information and questions beyond that point. So St John Ambulance Victoria has been a trusted and reassuring presence for over 130 years. St John is a self-funded charity in that we both have volunteer as well as commercial endeavors. To the commercial operations are to obviously support the charitable work that we do. In terms of help within the community, we organize things like the first aid in schools, which is providing first aid for primary schools, as well as a party ready, similar for high schools. We have the CPR labs. We have multiple volunteers providing a lot of first aid and events across Victoria. We have the community transport for the vulnerable, and we're also organizing DFibs in your street. Within our commercial operations, we teach first aid training. We also do Cert 3, 4, and deployment training in a bunch of different subjects, one of them being the one that we're talking about today. First aid kits and products is another way that we make money, as well as defibrillators, first aid services at events, and non-emergency patient transport. So first of all, why do the NEPT course? This course is for people who are looking to enter the non-emergency patient transport industry. And as an ex-paramedic, I think if you plan to become a paramedic, starting in non-emergency is the most logical way of doing it as well. It's basically anybody, regardless of where they want to end up, it's the doorway and the beginning to pre-hospital care. Non-emergency patient transport is a rewarding career for those who enjoy working with people from diverse backgrounds, have a compassionate nature, and want to make a difference. So in terms of general duties, we provide safe and caring transport to patients with low risk injury, a chronic illness, or a disability. The way I like to think of non-emergency is if when you call 000, let's say you've broken your ankle, they may not necessarily dispatch a paramedic straight away. That's where our non-emergency crews might come in and help. So we do still work within the AV system sometimes. It's just responding to hopefully lower acuity jobs. In terms of transport patients to and from, that's what we do in terms of hospitals, also aged care facilities, other medical facilities. So as part of this job, we really see all the different facilities and healthcare structures that we have in Victoria. The main thing about this job is that we assist patients in and out of ambulances, cars, helicopters, beds. The beauty of non-emergency is you can be anywhere and help anyone regardless of the environment that you're in. The job role that this course will help you get is a patient transport officer. There are many possible employees within this industry. There are private patient transport organizations, Ambulance Victoria, and St John Ambulance as well. We have a division in the non-emergency sector. Pathway course to these possible jobs is beyond this Cert 3 and doing patient transport officer. You can move on to a patient transport attendant, and we also provide and teach the diploma in that, as well as moving on to the paramedic if that's something that you would be interested in doing. St John Non-Emergency Patient Transport course is a course that is completed over 6 months. It has 13 units, all in different subjects, applying to different parts of healthcare. There are self-paced workbooks alongside these courses and units that you do on your own time at your own pace over the 6 months. To allow approximately 8 hours per week in terms of study time. There are 20 workshops of face-to-face training, including 4 observation shifts. And these 4 observation shifts are vital because they really show you the reality of the job as you are physically observing the role that you hopefully are going to get into. The full fee paying, of course, there are no government subsidies, unfortunately. However, government-based assistance may be applicable. Graduates will be granted an initial telephone interview for vacant patient transport officer positions in the St. John Non-Emergency Patient Transport Division. So after completing this course and you apply, as a result of completing this course, you'll be guaranteed an initial phone call interview for the job with St. John's. Credit transfer and recognition of prior learning. In relation of applying and starting this course, we also provide credit transfer and recognition of prior learning, or RPL. And these are 2 ways your previous education, training, or experience can contribute to a new qualification. Credit transfer is available for specific units of competency. If you've completed a certificate in healthcare previously, there may be specific units that you've already completed and you directly get those units removed from the Cert 3. Credit transfer forms obviously do need to be completed, obviously. Enrollment requirements for this course. The academic requirements, there are no prerequisites for this course. Participants must have appropriate literacy and numeracy skills, obviously. Admission requirements are you have to provide a valid, unique student identifier. You have to provide photo ID, undertake the necessary language, literacy, and numeracy assessment to see if you are where you need to be. You must have a laptop or tablet with internet access, intermediate skills in word processing and using internet. Additional requirements for this course: you need a valid driving license, obviously. Red P and learner plates are not accepted as part of this course. You need a current working with children check, current police check, current proof of vaccinations for influenza, less than 12 months, hepatitis B, varicella, pertussis, COVID-19, measles, mumps, rubella, with a serology report as well. And this is something you can consult your doctor with. Also, you must be clean shaven in terms of PPE requirements for the observation shifts. As a result of the COVID-19, we're having to wear PPE regularly, and obviously a full beard will upset those masks, and you can grow a slightly questionable moustache like myself. In terms of timetable, each workshop runs from 8:30 to 4:30. Students are required to read reference material before those classes start so that they're ready for the content contained within that workshop. In weeks where classes are not scheduled, you must complete self-guided learning. So if you're ready to enroll or need further information about this course, please visit stjohnvic.com.au, or you could call us on 03 85 88 8398. And that's between Monday and Friday business hours. Further from that, you can also email us at advancedtraining@stjohnvic.com.au. At St. John, we are incredibly passionate about providing high quality training and care within the non-emergency sector. Also, on a personal level, working as both a paramedic and within the non-emergency patient sector, I can't stress enough how rewarding and important this work is to get involved, especially within the current things that we're dealing with in terms of COVID-19 and other events. This is a wonderful industry to be part of, and you really can make a difference. Thanks for listening, and any further questions, please let us know.